So hey guys, my name is Rishabh Singh, a first year medical student from Eastern Medical College and Hospital, Comella. Welcome to my channel. If you are new here, so please go and subscribe to my YouTube channel. I try to provide you some educational video related to MBBS. I hope you will gain or acquire something new at the end of it. If you like, don't forget to subscribe, like and comment below. Guys, welcome to my YouTube channel. Today's topic is anterior abdominal wall part 2. Part 1 I have already uploaded on my channel. So if you are new to my channel, please go watch that video. So this is part 2 video, and in this video I'm going to talk about cutaneous nerves, about arteries, veins, and about the rectus sheath formation, muscle involved in abdominal wall formation, etc. So coming to today's topic, cutaneous nerve. The skin of the anterior abdominal wall is almost entirely supplied by the lower 6th thoracic nerve through intercostal and subcostal nerves. So basically intercostal nerve and subcostal nerve supply lower 6th thoracic nerve to the skin of anterior abdominal wall. So they are basically anterior cutaneous nerve and lateral cutaneous nerve. Anterior cutaneous nerve, like you can see, it is 7 in number, which are derived from the lower 5th intercostal and subcostal and iliohypogastric nerves. Now coming to lateral cutaneous nerve or the branches. So from two lower intercostal nerve through external intercostal muscle, it divides into inner, larger anterior and small posterior, which supply to the skin. It is a branch of subcostal and iliohypogastric nerve close to the iliac crest, supplying the anterior part of gluteal region. So this is all about the lateral cutaneous branches. As you can see the figure, in this cutaneous nerve of the anterior abdominal wall is clearly shown. Then coming to cutaneous arteries. The arteries are basically anterior cutaneous arteries, branch of superior and inferior epigastric artery. The lateral cutaneous artery are the branch of posterior intercostal artery, and the 3 superficial inguinal arteries are the 3 superficial branch of femoral artery. As you can see the arteries in the diagram, like you can see internal thoracic artery, which divide into musculophrenic artery, and other branch is also known as internal thoracic artery have 2 branches, musculophrenic artery and superior epigastric artery. And then superior epigastric artery is there, then umbilicus is there, then inferior epigastric artery is there, superior epigastric artery is there, then superior external pudendal artery is there, superior circumflex iliac artery is there, deep circumflex iliac artery is there, and posterior intercostal artery is there. So these are the arteries of anterior abdominal wall. Now coming to cutaneous superficial veins, it is below the umbilicus. It is divided into 2 parts, that is below the umbilicus and above the umbilicus. So above the umbilicus, they run toward the axilla and drain into axillary vein, as you can see in the figure, and thus eventually in the superior vena cava. And below umbilicus is this, they run downwards and drain into great saphenous vein in the groin, and thus eventually in the inferior vena cava. As you can see in the figure, they run downwards to drain in great saphenous vein, and it eventually drain into inferior vena cava. Now coming to superficial lymphatics of anterior abdominal wall. As you can see in the figure, it is also in 2 parts, that is above the umbilicus. Basically above the umbilicus, the lymph vessel run upward to drain into the axillary lymph node, which is anterior or in pectoral group. As you can see in the figure, axillary lymph node, and below the umbilicus the lymph vessels run downwards and laterally to drain into superficial inguinal lymph nodes. So this is the lymphatic drainage of the anterior abdominal wall. Now coming to muscles of the anterior abdominal wall. The anterior abdominal wall consists of 5 pairs of muscle, that is, it consists of 5 pair of muscle, 5 on either side of midline, 3 large flat muscle and 2 vertical, 1 large and 1 small. So muscles of anterior abdominal wall are 5 in number. So there are 2 type of muscles in the abdominal wall. One is the flat muscles, which are 3 in number and they are large. Then other is vertical muscles, they are 2 in number and in which one is large and one is small. Now coming to flat muscles. The flat muscle are external oblique, internal oblique and transverse abdominis. Now coming to vertical muscles, they are rectus abdominis and pyramidalis. So the origin, insertion and nerve supply. Origin by 8 fleshy slips from the outer surface of lower 8 ribs. The upper 4 slips interdigitate with the serratus anterior and the lower 4 slips with the latissimus dorsi. This is the origin of external oblique. Insertion by the fleshy fibers into the anterior 2/3 of the outer lip of the iliac crest. By this is the first insertion. Second insertion is by aponeurosis into xiphoid process, linea alba, pubic symphysis, pubic crest and the pectineal line. This is the insertion of the external oblique, and the nerve supply is lower 6th thoracic spinal nerve, that is the anterior rami of thoracic 7 to thoracic 12 nerve. Now coming to internal oblique. Fleshy origin from first origin is lateral 2/3 of the inguinal ligament. Second origin is anterior 2/3 of the intermediate area of iliac crest, and third origin is thoracolumbar fascia. Now coming to the insertion of internal oblique. So by fleshy fibers into the inferior border of the lower 3rd or 4th ribs and their cartilages. This is the first insertion. Second insertion is by aponeurosis into 7th, 8th and 9th costal cartilage, xiphoid process, linea alba, pubic crest and pectineal line of pubis. Now coming to nerve supply. Lower 6th thoracic and 1st lumbar spinal nerves, that is anterior rami of thoracic 7 to thoracic 12 nerve and lumbar 1. Transverse abdominis. This is the third muscle of which we consider in the flat muscle group. So coming to the origin, it is lateral 1/3 of the inguinal ligament, anterior 2/3 of the inner lip of the iliac crest or thoracolumbar fascia, or inner surface of the lower 6 costal cartilage. These fibers interdigitate with the diaphragm. So these are the origin of the transverse abdominis. Now coming to its insertion by aponeurosis into xiphoid process, linea alba, pubic crest and pectineal line. Now coming to the nerve supply. Lower 6th thoracic and 1st lumbar spinal nerves, anterior rami of thoracic 7 to thoracic 12 or lumbar 1. Now coming to vertical muscles. The vertical muscles are rectus abdominis and pyramidalis. So the origin of rectus abdominis are by 2 tendinous head, lateral head from the lateral part of the pubic crest and the medial head from the anterior surface of the pubic symphysis. Now coming to insertion. 5th, 6th and 7th costal cartilage along a horizontal line and xiphoid process are the insertion of the first vertical muscle of the anterior abdominal wall. Now coming to nerve supply. Lower 6th or 7th thoracic nerve, anterior rami of thoracic 7 to thoracic 12 nerve. Now coming to pyramidalis. Its origin is anterior surface of the body of the pubis and anterior pubic ligament. Now coming to insertion into the linea alba. Now coming to nerve supply. Subcostal nerve, that is thoracic 12. So this completes our topic on the muscles of abdominal wall. Now coming to what are the structure which are derived from the flat muscles. So inguinal ligament, conjoint tendon and cremaster muscles. These are 3 which are derived from the flat muscles. Now coming to movement of trunk. As you can see, the flexion of trunk, lateral flexion of trunk and rotation of trunk. These all are the movement that is possible in the muscles of abdominal wall. Now coming to rectus sheath. This is one of the important topic. The rectus sheath is an aponeurotic sheath enclosing the rectus abdominis muscle and pyramidalis muscle if present on the either side of the linea alba. It is derived from the aponeurosis of the flat muscles of the anterior abdominal wall. The function of rectus sheath include checking and bowing of rectus abdominis muscle during its contraction and hence increasing its efficiency. And point 2 is maintaining the strength of anterior abdominal wall. So these are the functions of rectus sheath. Now coming to feature of rectus sheath. So as you can see in this diagram, this is anterior and posterior walls of rectus sheath. So the features of rectus sheath are that the rectus sheath presents anterior wall and a posterior wall. As you can see, anterior wall of rectus sheath and posterior wall of rectus sheath. The anterior wall, this wall, is complete and covered the entire extent of the muscles. As you can see, it is complete and covering the entire extent of the muscle. However, the posterior wall is deficient and above and below and doesn't cover whole muscles. So as you can see, it doesn't cover whole muscle. And above is attached to the costal margin, that is 7th, 8th and 9th costal cartilage. So this is attached to 7th, 8th and 9th costal cartilage, as you can see in the figure. And below it is a present of free curved margin with concavity facing inferiorly called arcuate line, the line of Douglas between umbilicus and pubic symphysis. As you can see here in the diagram, there is arcuate line which is between the umbilicus and the pubic symphysis. It is also called the line of Douglas. This is another figure. In this you can see the fold of Douglas here and the fascia transveralis here, and these are the nerve of posterior wall of rectus sheath. Now coming to the formation of rectus sheath, it differs from above to downward. As you can see in the figure that it differs from upper to downward portion. Above level of costal margin. This is the above level of costal margin. In this there is anterior wall and posterior wall. Anterior wall is derived from aponeurosis of external oblique, and posterior wall deficient and muscle lie directly on the 5th, 6th and 7th costal cartilage. Now coming to between costal margin and arcuate line, that is in which anterior wall is formed by the fusion of aponeurosis of external oblique with the anterior lamina of aponeurosis of internal oblique, and posterior wall by the fusion of aponeurosis of the transverse abdominis with the post lamina of aponeurosis of internal oblique. Now coming to below the arcuate line or the line of Douglas or the fold of Douglas, anterior wall and posterior wall. Anterior wall is formed by the aponeurosis of all the 3 flat muscles, the aponeurosis of transverse abdominis and internal oblique fused, but the aponeurosis of external oblique remains separated. So these form the basically your below the level of arcuate line anterior wall. Now coming to posterior wall is deficient. In this figure you can easily see and understand how the above level, how between level and how below level is formed in rectus sheath. Now coming to the contents of rectus sheath. The rectus sheath contains 2 muscles, rectus abdominis and pyramidalis if present, 2 arteries, superior epigastric and inferior epigastric artery, 2 veins, superior epigastric and inferior epigastric, and 6 nerves, that is terminal part of lower 6 thoracic nerve including lower 5 intercostal nerve and subcostal nerve. They are accompanied by terminal part of posterior intercostal vessel. As you can see in the diagram, the contents you can see in the diagram: superior epigastric artery, inferior epigastric artery, and then you can see the different muscles, basically 2 type of muscles, rectus abdominis muscle and also the pyramidalis muscle. Then all the nerves you can see, all the 6 nerves you can see. So this completes our topic from the rectus sheath. So now the topic is deep nerve of the anterior abdominal wall. These nerves are derived from the lower 6th thoracic and 1st lumbar segment of the spinal cord and supply the anterior abdominal wall. So these are basically in the deep of anterior abdominal wall. These include lower 5 intercostal nerve from thoracic 7 to thoracic 11 nerve, subcostal nerve thoracic 12, iliohypogastric nerve lumbar 1, and ilioinguinal nerve, that is lumbar 1, direct from lumbar 1 spinal cord root value. Lower 5 intercostal nerve. So basically they are lower 5 intercostal nerve from thoracic 7 to thoracic 11. This is the root value of lower 5 intercostal nerve. Subcostal nerve root value is thoracic 12. Iliohypogastric nerve root value is lumbar 1, and ilioinguinal nerve root value is lumbar 1. Now coming to deep arteries of the anterior abdominal wall. The deep arteries supply the anterior abdominal wall are superior epigastric artery, musculophrenic artery, inferior epigastric artery, and deep circumflex iliac artery. These are the deep arteries of the anterior abdominal wall. Now coming to topic fascia transveralis. The fascia transveralis is a thin layer of fascia that lines the inner surface of the transverse abdominis muscle extent. Superiorly it is continuous with a similar layer lining the inferior aspect of the diaphragm, that is diaphragmatic fascia, and inferiorly with the fascia lining the iliacus muscle, that is the fascia iliaca. So these are the extent of the fascia transveralis, and we can also say that the fascia transveralis is a thin layer of fascia that lines the inner surface of transverse abdominis muscle. So it's a topic on fascia transversalis. So now coming to common abdominal incision topic. This you can see various incision like Kocher's incision, that is subcostal incision. This is used for the gallbladder and the associate duct surgeries. Then upper midline incision, as you can see the upper midline incision here. Then this is the umbilicus. You can see a paramedian incision, which has many advantages than the midline incision, as the post-operative weakness is minimum and the chance of hernia is also minimum in this paramedian incision. Now coming to lower midline incision. This is the lower midline incision. And now coming to McBurney's gridiron incision. This is the incision that we use in appendectomy in the inflammation, when the inflammation of appendix occurs, appendicitis. Then we perform McBurney incision for the appendix surgery. Now this is a transverse incision on the line of venous. It is also called in this the incisional hernia is minimum, and it is also for the ovary and uterus surgery. So these are the various incisional area of the abdomen by which we can do various surgeries. And the advantage of midline incision is also there, like you can see the midline incision here. This have it that it is almost bloodless, no muscle fiber are cut across, no nerves are injured. It give access to both surface of the abdomen as it is midline. So these all are the advantages of midline incision. So this completes our topic, today's topic on anterior abdominal wall and the clinical correlation related to it. Thank you. If you like my YouTube channel, then please don't forget to subscribe to my YouTube channel, which is MBBS Studies with Rishabh Singh. In future I will also upload various type of videos that will be helpful to you. So please like, subscribe, comment, share my YouTube channel. Thank you.